Okay. We got 5 o'clock. I'd like to call the Health Committee meeting to order for the month of June. Under previous business, let's take a roll call.
Sure.
Rebecca,
Sure. Mr. Joyce?
present?
McLaughlin? Baston?
Yep.
Miller?
Present.
Peto?
Yes.
Robinson? Ward is excused. Collins? And Lockhart.
Here.
You have a quorum.
Thank you, Rebecca. Under previous business, can I get a motion to approve the previous meeting minutes? Motion made by Mr. Beston, second by Mr. Miller. All in favor?
Aye.
Any opposed? I understand number 2 and 3 are being tabled on the request of the sponsor.
Yes.
Okay, thank you.
Mr. Ward.
Mr. Ward is present. Beat that traffic, huh?
I didn't beat it, but I'm here.
Okay, with 2 and 3 being tabled at the request of the sponsor, we're going to move on to current business. Number 4, we have Mr. Fine tonight with his local law on the tattoo code. Number 4, public hearing on the proposed local law number I for 2024, a local law of the County of Albany, New York, amending Chapter 265 of the Albany County Code to update the tattoo code provisions. This is, again, just for the public hearing. We're going to end up tabling the actual local law until after the public hearing, but does anybody have any questions for the sponsor in the meantime? Patty?
I just was curious, what was the impetus for this? Seems like a good idea, I'm just wondering.
Yeah, a couple of things. One, it was time to modernize the code, but also we wanted to remove barriers to holding tattoo conventions. There's someone who's trying to hold a tattoo convention in Albany County, bring in tattoo artists from all over the area and host a convention in the Capitol Center, and it'd be a big economic driver for the region, and we want to be open for business for those types of events.
Oh, okay.
So we looked at the code, we talked to the health department, and said, is there a way that we can remove some of the obstacles to doing things like that while also modernizing the code in other ways, while also not sacrificing our commitment to public health, and they provided us with this language.
Oh, okay, so the conventions wouldn't have been able to be here before that because of...
Well, the biggest barrier was a requirement that there be sinks at every tattoo station. So the old code required sinks to wash hands, while the new code allows what is called FDA-approved antiseptic rub, which is a little bit different than hand sanitizer. It's what's used in the medical field.
Okay. Thank you.
Yes, Mr. Fine did his due diligence working with the Department of Health, and they were very accommodating to make sure that when you change public health code, we don't violate, we don't make public
Right.
health more of a risk. So do appreciate the Department of Health's input on that, so thank you. So again, this is just for the public hearing. I do believe we have to make an amendment to adjust the date on that.
To July 23rd.
July 23rd, we need a motion for the amendment?
Yes.
Okay. Motion to make the amendment July 23rd, 2024. Motion made by Mr. Miller, second by Mr. Beston. All in favor?
Aye.
Any
Aye.
opposed? And so do we have to actually take a vote on the actual? Okay, so
Motion for the public hearing.
for the public hearing, motion made by Mr. Miller, second by Mr. Beston. All in favor?
Aye.
Thank you. Thank you, and thank you, Sam.
Thank you.
So with that, after the public hearing, we're going to have to table number 5 until after the public hearing. So we'll move on to number 6. We have Health Department here tonight. Number 6, authorizing an agreement with the New York State Department of Health and Health Research Incorporated regarding the Public Health Emergency Preparedness Program. Good evening.
Good evening. My name is Emma Simmons. I'm here from the Department of Health. We are asking to enter into contract, as you said, to receive $341,000 for this upcoming year, July 2024 to 2025. The money we use to help our public health emergency preparedness program, to continue training our staff members, and it supports our director, our staff, and training sessions. So all of that revenue is in our budget already, and so we get this money annually every year. So.
Thank you. Do we have any questions from the committee? Okay. Night.
Motion?
Hearing none, we have a motion made by Mr. Miller, second by Mr. Beston. All in favor? Any opposed? Thank you. Unanimous. Thank you. Moving on to mental health. Number 7, amending the 2024 budget of mental health budget, individual placement and support employment specialist. Good evening.
Good evening,
Mayor
Mr.
Donovan.
Chairman, members. Here with Michael Fitzgerald, our fiscal officer. This first item that we have in front of you today is to amend the 2024 mental health budget. We have an opportunity to bring on at the state OMH's paying bill an employment specialist to join our ACT team. The state has taken, I think, the understandable position that focusing on trying to get people with chronic mental illness more opportunities to be employed in the community is a good idea. We certainly agree. And they are funding this position for those communities that do ACT programs, and we are one of those. ACT is assertive community treatment. So this would be an amendment for 5 months in this year, and then it would be carried over in subsequent years. It's 100% state OMH funded, and we ask your permission to amend the budget.
Sure. Do we have any questions from the committee? Hearing none. Motion made by Mr. Ward, second by Ms. Idle. All in favor?
Aye.
Any opposed? Unanimous.
We're fighting for motions over here.
Hey, that's a good thing. Number 8, authorizing the submission of a grant application to the New York State Office of Temporary and Disability Assistance regarding the Solutions to Homelessness Program grant.
Yes, sir. So if you recall, last month I came to you with a couple of grants that we had submitted in between our time of meeting with you. We have the good fortune of having someone to be looking for and submitting grants on our behalf, and we have 2 more this month that very tight timetable we submitted, and we're coming to tell you that tonight. This one is very intriguing. It's from the New York State Office of Temporary Disability, OTDA, and it is an opportunity to come up with innovative programs to address homelessness and mental illness. This is a 3-year grant, Solutions to End Homeless program. It's called the STEP program. And we've submitted an application. It's an idea that we've had for a couple of years. It's a street psychiatry program. And in this first year of the grant, there's $16 million for innovative ideas throughout the state. We put forth one that we gave them the Cadillac version, and it's $1 million, and it's a 3-year grant. It is it's a vision of staffing a street team that would work with mentally ill homeless people. It's been tried elsewhere. We almost pulled this off a few years ago, but we never quite got there. So we're hoping that you'll understand that there was a tight timetable. We submitted the grant, and really now, I think if we would receive, it's $1 million for 3 years. It would really put us in a good position to address this problem.
You did more now than ever, right?
More than ever.
Do you have any questions, Patty?
Doctor, you said this is a new program for us. You
It
said
would be.
it will be, yeah. It's been done elsewhere?
Yeah.
Where else has it been?
Yeah, so we were actually very fortunate to meet a physician who, this is her area of specialty internationally and nationally, doing street psychiatry. And she was out of Rochester. They were doing it in Rochester for a while. She also did this in India, and she's on the medical faculty at Yale, and she almost came to Albany a few years ago. And she didn't, but her idea stayed with us, and we've been trying to figure out a way to create a path to get there. And this, interestingly enough, she has offered still to be our mentor from wherever, Yale's, Hartford, Connecticut, or somewhere out there.
Mhm.
Yeah, so it's been done, and it's been done successfully as part of street medicine. We don't have a street medicine team, but we would this would be a 5-person street psychiatry team. Social workers, prescribers.
So that's what I was going to ask you, social workers, what else were you?
Well, I'll tell you exactly.
Would there be a psychologist or psychiatrist?
Yes, well, there'd be a prescriber. It could be a nurse practitioner or a psychiatrist.
Okay,
And we have 2 social workers, 2 peers, and a psychiatric nurse. So it would be a full team. And what's interesting about this, as most of our programs are designed to engage people and bring them into the office, this program is street-based. And there are some people who never want to take that offer to come in. So this would be, a mobile treatment team. We have a mobile crisis team, we don't have a mobile treatment team.
yeah.
So, and if we don't get the grant, we still will try to push it and get this idea implemented maybe in a smaller format, but we're optimistic.
Thank you.
Thank you.
Any other questions from the committee? Hearing none, can we get a motion to move? Motion made by Ms. Petto, second by Mr. Beston. All in favor?
Aye.
Any opposed? Unanimous. Number 9, authorizing the submission of a grant application to the New York State Office of Addiction Services and Supports regarding the electronic medical records implementation grant.
Yes, so this is the New York State Office of Alcoholism and Substance Abuse Services, and they put out a grant for communities to upgrade their electronic medical record system to communicate better with the state. They collect an enormous amount of data from us, and we provide it every month. But this would streamline the process, and it would also allow us to do our own data analysis and mine the data in a way that we haven't been able to date. It's $120,000. It's one time only, but we believe it would really help us upgrade our electronic medical records. Each year, I come to you to renew the contract with our Information Management Associates. They're our electronic medical records vendor. We've been with them for 35 years. We have 500,000 case records in this electronic medical record. And it is pretty much state-of-the-art, but this would, I don't know what's beyond state-of-the-art, but this would like make us more state-of-the-art.
+1.
Plus one. And so I think this is actually a guarantee to get this. So we hope you agree.
Thank you. Do we have any questions from the committee? Hearing none, can I get a motion to move? Motion made by Mr. Ward, second by Mr. Miller. All in favor?
Aye.
Any opposed? Unanimous. Moving along. Number 10, authorizing an agreement with the Whitney M. Young Junior Health Center regarding the home health services and amending the 2024 Department of Mental Health budget.
Yes, so this, just as a bit of context for this, 2 years or so ago, Whitney Young announced that they were merging with Equinox. And they have been on the path of Whitney Young being the parent organization. They would incorporate Equinox services. Equinox has a very long and good reputation, and they're not going to lose the name, but they're going to be, in the next couple of years, a subsidiary of Whitney Young. One of the first steps of this transition was to move the Equinox Health Home. And I've been here before to tell you about this. Health Home is not a place, it's a thing. Their Health Home services is like an intensive case management program, moving that from Equinox to Whitney Young. There's money that the state gives us every year for this program that we had normally given to Equinox. It's passed through state aid funding. Every year I come and ask for the renewals of those contracts. So Whitney Young is now going to be the program of record. We don't have a contract with Whitney Young to pass through this money to them. So we're asking that in 2024 we enter into contract and move the money from Equinox to Whitney Young to continue this health home service, which has been longstanding.
Thank you, Doctor. Do we have any questions from the committee? Hearing none, can we get a motion to move? Motion made by Mr. Miller, second by Mr. Beston. All in favor?
Aye.
Any opposed? Unanimous. Thank you.
Thank you, sir. I appreciate it very much.
Thank you. get a motion to adjourn? We will. Motion made by Mr. Miller, seconded by Ms. Widow. Favor? Thank you.
Good.